your title is not Ministry of Sickness, your title is Ministry of Health. So keeping your people healthy, you need to focus on promotive and preventive. And preventive means you need to have a very good screening, you have to very good surveillance, to prevent your people to become sick. And that is cheaper and better quality of life. I will talk about what we have done later on, but it is very important, the key message, keep your people healthy. Don't let them sick. And then hopefully our people can live to the average life 72, and if they have to die, then the day after today, they just die without any sickness. Thank you.
Thank you so much, Pak Budi. And also, we would like to say welcome to the Prime Minister of the Kingdom of Eswatini, His Excellency Russell Mimiso Dlamini. Thank you for gracing us with your presence. Thank you so much. Now, I would like to turn the spotlight now to Angola, to Mr. Inocencio, His Excellency Inocencio. What lessons have been learned from the recent pandemic responses in your country, and how are these lessons shaping the future preparedness strategies? Ladies and gentlemen, you are most welcome to use your headset or interpreting device. Go ahead, sir.
Muito obrigado pela palavra. Saudar a todos os presentes e, em especial, os painelistas, as autoridades cá presentes. Dizer que o nosso país, Angola, teve um grande desafio durante a pandemia da Covid-19 e tivemos, como a África tem a sua característica, apesar de ser um continente grande, altamente resiliente, tem uma população jovem, com uma capacidade muito grande de desdobramento, razão pela qual tivemos que recorrer às condições existentes, se fazer um trabalho grande de organização a nível do nosso país. Houve, neste caso, uma liderança muito forte de Sua Excelência o Presidente da República, Dr. João Manuel Gonçalves Lourenço, com a formação de uma comissão multissetorial de prevenção e combate à Covid-19.
Establishing a multi-sectoral cooperation to combat COVID-19, it is a key point to coordinate all relevant activities. In this commission, they have the authority and specific task to coordinate multi-stakeholder actors. This is a unique, which is the National Commission on Health, cross-sectoral at the provincial and regency level, down to the grassroots level of the society. So we could gather communication, effective communication and surveillance. We could also increase the response action at the human resources level, and we could improve the health of our community. I would also like to emphasize that we have prepared preventive action where we have very rapid response through diagnosis, quarantine, as well as isolation to control the border. We also did CPR tests, and we increased the laboratory capacity in which Angola can improve their response capacity. That allows us that in 6 months, we did not have confirmed cases. So we were successful in responding to the crisis. We have carried more than 5,000 bed and ventilator and reagent test in some laboratories, mask, as well as several other health machines We have done also campaign and work to raise awareness. We have also increased more than 42% of human resources and health to prepare the pandemic in our country. So we continue this response as we believe that major challenges and lesson learned that we have dealt with. The most challenge was to provide vaccine. That's why we are here now. Our president, Mr. Zhao, is planning to collaborate with the CDC Africa, and we will also have cooperation with Indonesia to improve our local medicine, as well as our other challenges and other relevant implementation in our country, and also cross-sectoral cooperation, which is very important as part of this administration. The ability to surveillance is also important, laboratory surveillance, as well as quick reporting, in which we could conduct surveillance in accordance with the national protocol. And it is also important to continue training for human resources. And we would also like to emphasize effective communication between the community at the local level so that we can have appropriate response. What's also important is production of medicine from the pharmacy company, and to emphasize the importance of human resources.
His Excellency, to follow up on your statement, I'm sure crisis response time is key, but what are the barriers to equitable vaccine distribution in your country, and how can international collaboration mitigate the challenges?
Dizer que, de novo para pôr os microfones, dizer que é muito importante o desafio do acesso às vacinas. Isto para todos os nossos países da África, passamos por este período.
Neighboring countries in Africa, because they are dealing with the same challenges. We need to sit together to discuss this matter, and our country has more than 19 million of vaccine. It's around 85%. It covers 85% of our people. That could increase our immunity. And also, there were 19,000 deaths in Angola. This access to vaccine and also medicine has brought us on the need to improve international cooperation. So we will coordinate better with WHO and also regular authority in Africa and our country under the leadership of Mr. President. In the next time, he will have a visit to Indonesia, and he cannot wait to come to Indonesia so that we can have better collaboration with CDC Africa, because our country must prepare for our local production, like I mentioned previously, to establish an agency to produce local vaccine. And we need to also prepare our regulation at the domestic market, and we want to prevent, and we want to improve national production. We also emphasize knowledge transfer and also training of human resources so that all African countries and Indonesia, we can transfer of knowledge and also improve local production and medicine.
Local people are contributing to the effort. Yeah, thank you so much. Quickly to Pak Budi, if that's okay, Minister Budi, would you like to respond to what Angola has done so far and what potential collaboration that we can do between Indonesia and Angola?
I think it's, we have to understand that this pathogen, when we have infectious disease, it will travel all over the world, and regardless which country you are, what races you are, it doesn't really matter. So collaboration is a key. That is, it is scientifically wrong if you believe that your country can be protected if you only vaccinate or protect your country alone. And it is also ethically very, very wrong if you prioritize your country compared with other countries. Yeah, yeah. So it's scientifically is wrong and ethically is wrong. When the pandemic happens, it will hit all people globally equally, whatever races you are, whatever country you are, whether developing country or developed country. So we have to build as a single world and single humanity to fight them all. And it is very critical that all countries have the same level of protections. It is scientifically wrong if you want to protect your country alone, but the other country is not protected. Because, the pathogen will come into the weak country and then it will affect you also. So that's why it's very important for us to understand that to go together and similar strength is very, very important. And this is need a very strong healthcare system. That's why in Indonesia, we have to do by ourselves first. We strengthen 10,000 puskesmas that we have, primary healthcare clinics, with all the surveillance tools and the detection capability, the PCR machines. And then we develop 514 public health laboratory that can do genome sequencing capabilities and PCR testing capabilities. So we have a good surveillance system. But on top of that, we need also to develop the vaccine research and development capability. I managed to put one of our Director General at the board of CEPI, so we have access to development capacity, research and manufacturing for mRNA technology. And I believe Africa should have the same thing too. I strongly support my friend from African CDC that Africa need to have a very strong research and manufacturing for vaccine. Pasteur Institute 100 years ago came to Indonesia and built biopharma, but I heard also Pasteur Institute also came to Senegal, right, to develop their capacity. We just need to upgrade the research and development and manufacturing capacity. So every southern country in Africa, southern country in Asia, southern country in America, they should have a very strong research and manufacturing capacity for vaccine. So that is the very strong reason that we need to work together. And I will summarize again. This war with pathogen, it is scientifically wrong if your approach is only protecting your country. And it also ethically wrong if you only protect your people as other people is not worth it. Thank you.
Can't agree more. Yes, I can see the majority of our audience are nodding. And yes, we also have Africa CDC and 2 pharmaceutical company. We'll turn the spotlight later on to you, gentlemen. But this one goes to Minister Ibrahim from Sudan. What are Sudan's key health priorities and needs that could be addressed through further cooperation with Indonesia? The floor is yours.
Okay, thank you very much. And first, let me to thank Indonesian government and the Minister of Health for having this very big, important events bridging the gaps between African countries and Indonesia, looking ahead for the vision of Indonesia and the agenda of Africa 2063. You know that despite the situation in my country, the war now is more than 1 year. And this, from the beginning, reflects the situation of health in the country. And despite that, I made the decision to come to attend this meeting. Despite that, people behind me are waiting for health services, for humanitarian responses. But I made my decision to come to attend this meeting. And this, first, because of the importance of this meeting, bringing together all African leaders, Indonesian leaders, all those who are making decisions in prosperity of lives for the 2 nations and for the health of the people. For that reason, I made my decision to come and attend and to share our views, our situation with our colleagues here in Africa and in Indonesia. Second, also, to raise the voice of my people in such events, to be the voice of more than 48 million people, children, mothers, waiting for me, behind me. For that reason, I came here and to share the priorities of my country. You know that under such circumstances like Sudan and other countries in conflicts or in disaster, the top urgent health responses will be those essential to save lives of the people. For that reason, from the beginning of the war, we have stated a response plan composed of 5 top priorities to save the lives of the people. First is to ensure that the life-saving medicines and supplies in the country are available for the people. And this is very challenging because we lost almost all the in-country manufacturing companies, more than 26 pharmaceutical companies in the country now were lost due to that war. For that reason, we start heading outside the country and make collaborations and discussions through UN agencies, through other countries to support Sudan during this. The second top priority is ensuring continuity of health facility working, providing essential care services, providing emergency care. And you know that many of the people are in need for emergency response. And in Sudan, we have like more than 6,000 healthcare facilities. Now, almost 25 or 30% of these healthcare facilities are out of service. And we are trying our best to make the rest providing the services, ensuring critical care for the patients, ensuring saving of the lives despite the continuity of it. The third and important one is to ensure that the ability of the country to reduce the burden of the outbreaks, epidemics, and diseases. And you know that in such crises now, the world are facing with many diseases of a pandemic phenomena, as you have mentioned, like Mpox, for example, or poliomyelitis. For that reason, I call for what just Budi has said, the minister. When pandemic come, all people are equal. Disease has no border. For that reason, access to immunization, access to vaccination, access to this protecting one country is protecting the whole world. For that reason, access to immunization or access to essential medicine to protect epidemic and outbreaks, it is a human right. We all call for that, regardless the capacity of the country, economic capacity to buy the vaccine or not to buy the vaccine. It is the responsibility of the whole world to ensure that all the population in the globe are protected against epidemics and outbreaks. The fourth one is to ensure continuity of the health services for the mothers and children. Those are marginal groups, are the under 5 mortality in my country, the maternal mortality are high. For that reason, we are focusing on this group to provide essential services for them. The fifth one, which is the important one, and the last one, is to make that response under collaboration and coordination with the UN agencies, international organizations, and all partners. And we set up a platform with all organizations and UN agencies to work together to, one in a solidarity manner, to cater and reduce the effect of war on Sudanese population. Unfortunately, till now, despite the protracted war, now 1.5 years or more, despite that, till now, the health system is resilient. The health system is doing its job. The health system is trying the best to save the lives of the people. Thank you very much.
Thank you so much, Minister. So My heart goes out to your country due to conflicts. Obviously, life-saving meds is important. Healthcare facilities is important. Outbreaks and pandemic preparedness, access to vaccine and collaboration with all parties, those are all important. So we are, I mean, on behalf of the citizen of Indonesia, and also I'm sure Pak Budi will be more than happy to help you. Let's collaborate, yeah? Okay, so let's turn the spotlight now to DG, Africa CDC, Dr. Kaseya, thank you so much for waiting. Could you share some of the current research initiative spearheaded by Africa CDC that are making a significant impact on public health? Would you like to share with us?
Thank you. Please let me first thank Indonesia and my brother, Minister Budi, for inviting me here. And let me recognize the Prime Minister of Eswatini. It's good to have our Prime Ministers attending this kind of meetings. Next time, please invite most of your peers, because they will continue to support our agenda at the country level. I have my brothers from Angola and Sudan who share their experience at country level. But let me tell you, Africa CDC, we are leading the agenda for 1.4 billion people in Africa. And it means when we talk about research, we talk about something that will help us to stop with all outbreaks that we have, that will help us to save life of people. I will take just 3 examples. Let us talk about malaria. Malaria is the killer of our children in Africa. What kind of research we conducted before that? Not too much, because I have to say every day, if malaria was in Europe or in the US, all solutions will be found very long time ago. But because it's in Africa, now we are taking it seriously. And you know, we just introduced a new vaccine, but this vaccine is not at the level of efficacy that we are expecting. This is why we need to combine with other tools. Another tool that we are talking about, this is the ongoing research we are doing, is the therapeutics. We are talking about artemisinin. Artemisinin is this medicine that is helping us to cure malaria. But we saw there is resistance, and we are working to fight this, to conduct some research against this resistance. I will quickly talk about 2 other diseases, and the first one is what accelerated even the creation of Africa CDC. It's the Ebola outbreak that we had in 2014-15 in West Africa. And after that, Africa CDC was created in 2017. But you know, Ebola and the Marburg are part of what we call filovirus family. And now we are conducting research on post-exposure prophylaxis. It means a drug that you can have if you are exposed to Marburg and Ebola to prevent to become sick. I think this is a major outbreak because we still have Ebola outbreaks in a number of countries in Africa. The last one is the research that we are doing on the Mpox vaccine. As you know, 80% of my time today is Mpox, fighting this Mpox outbreak. And it's good to remind that Africa CDC declared the public health emergency of continental security before WHO. We are followed by WHO. It means we take seriously what's happening in our continent. This is I wanted to take these 3 examples of the main killer of an outbreak that created Africa CDC and the ongoing huge outbreak.
Okay, thank you so much, sir. This is a perfect segue to Pak Shadik Akasha from Biopharma. In what ways do you collaborate with government agencies and international organizations to ensure sustainable and affordable healthcare solution in the region? Go ahead, sir.
Okay, thank you. Biopharma is general utilization in pentahelix model to ensure sustainability innovation and also for the affordable health solution. I think this is approach have been during from the pandemic situation on 2020 and vaccine Innovac through the first is collaboration with academia. This is namely Baylor College Medicine, US, from receiving master seat in Indonesian University, and also from University of Andalas, and from clinical trial protocol. And on the other hand, we have to collaborate with business partners like Dynavac Technology to provide essential adjuvant and for the production. And the other is how to collaborate with WHO and Indonesia FDA to fulfill guideline and marketing authorization. And the important thing is how to collaboration with Ministry of Health, especially from Pak Budi. Pak Budi have some direction to our company, and also from COVAX, UNICEF, immunization policy, market supply and demand, and collaboration with professional association. Some of the Indonesian association like IDAI and PABNI, and the important thing also from the media channel who can promote vaccination, awareness, and market access. And for the comprehensive approach, Enable Biopharma is already have successfully distributed over 120 million doses of vaccine COVID-19 across 38 provinces, strengthen Indonesian healthcare infrastructure, and provide model future international collaboration. Thank you.
To follow up on that, before I turn the spotlight to Mr. Tripathi, building on the success of Biopharma's expansion of vaccines to Africa, what strategic approaches can Biopharma employ to expand its presence in Africa and foster collaborative partnership to achieve greater impacts in the region, both in Indonesia and Africa? Go ahead, sir, before I turn the spotlight to Tripathi. Go ahead.
Now, Biopharma has significantly expanded its vaccine supply to African. This is more than 5 countries through UNICEF and various bilateral models. This is effort including distribution like EPI vaccine, such as measles, polio, bacterial and combination vaccine as well, and like NOPV and OPV too. To achieve more substantial impact, Africa, Biopharma has strategically aligned itself to the goals of African Union that is producing more than 60% and vaccine locally by 2014, and we will support it. And we can accomplish by offering targeted capacity building, initiative, assistant fundamental, facility manufacturing, and gradually for the deepened Biopharma partnership contribute to continent self-reliance and vaccine production.
Okay, thank you, sir. Now on to Mr. Tripathi. Thank you so much for waiting. Given the recent MOU signing with Biopharma for the transfer of ready-to-fill technology for the TD vaccine, how do you envision this collaboration impacting the vaccine production and distribution in Ghana and the broader West African region?
Thank you for the question, Madam. The Honorable Health Minister, the DG Africa CDC, and other colleague panelists. We started this collaboration with the Indonesian vaccine company, PT Biopharm, last year in December, when the Honorable Deputy Minister of Foreign Affairs visited Ghana, and we signed the Memorandum of Understanding. And in the last about 8 months' time, we have done a lot of due diligence with the 2 of the companies, and we are in the process of signing the agreement, proper agreement between the 2 companies. Atlantic Life Sciences is a Ghanaian vaccine company, and we are in the process of establishing a plant for the tech transfer, very sophisticated one, and this can be very helpful for the continent. It can be very helpful for the West Africa to produce TD vaccine. And our limit is not only Ghana, because the population of Ghana is about 32 million, and vaccine production cannot be limited to only to a smaller scale. So we are looking for that, how best we can expand it in our operation to the West African countries by collaborating with the PT Biofarm. I will take this opportunity to thank management of the PT Biofarm, the president of the PT Biofarm and their management team for collaborating with Atlantic Life Sciences Ghana. Thank you.
Thank you so much. To follow up on that, could you elaborate on Atlantic Life Sciences involvement? I heard there's a one district, one factory initiative. So what success or lesson learned can you share from that initiative?
The 1D 1F is an example of collaboration with the government. 1D 1F is an initiative by the government of Ghana to support to the industries. We got about $10 million at a very initial stage at the subsidized loan under the 1D 1F, and we started the producing various sterile products like infusions, injections, eye drops, anesthesia medicine, and we can say that that support by the government has been very useful. We can say that not only Ghana, in the West Africa countries, we have become self-reliant for many of the such products which have been largely imported from out of the West Africa market. So by 1D 1F, the support from the government is created a lot of employment. We have brought a lot of technology transfer for the other products. Very initiative one is anesthesia medicine, product like sevoflurane, isoflurane, which we are creating. And also we have brought a lot of expertise and creating training to our staff. And by this way, we can say that 1D 1F has been a very good initiative for our project to create employment and also for the health security for the sub-region.
Okay.
Thank you.
Thank you so much. And also in Indonesia, ladies and gentlemen, we do have a Satu Sehat app. Now this question goes to Minister Budi. Pak Budi, how does the minister plan to leverage the Satu Sehat app to adapt to future healthcare challenges and ensure the resilience of Indonesia's healthcare system?
One of our key initiatives during COVID is to develop these apps to identify whether you have been screened. So it is used to enter any public facilities, including travel, using public transportations. But after COVID, this application, because it has already downloaded more than 120 million people, is being used for our citizen health apps. So now all screening data of our people, whether it's blood tension, blood sugar level, also cholesterol level, and more advanced screening at the hospital like the ultrasound data, the CT scan data is being uploaded into these systems because we already have this platform for more than 120 million people. And now, because we strongly believe that prevention is very, very important, we embarked a very aggressive campaign through 300,000 posyandos, we call it mobile community workers, at 10,000 puskemas to screen this critical risk factor. And half a year, we have screened 60 million people, the blood sugar, blood tension, and also cholesterol level. And we also screen around 10 million for early identification for cancer. And all data is already inside this application, so we can identify what kind of intervention that we would like to do for each of the people. And this data is by name, by address, geotagging with Google Earth. That's why it needs also the connectivity. Indonesia has 17,000 islands, 7,000 uninhabited, 10,000 puskemas, 2,700 of it has a very poor internet connections. That's why 6 months ago, we invited Elon Musk to come to Bali. We signed an agreement. So these 2,700 puskemas will have access to Starlink connectivity. So then those data can be transmitted to the ministry databases, and we can design the right interventions, whether we give amlodipine to the people or metformin or statin to those people to make sure that health conditions are controlled, to avoid them, to keep them healthy, not to cure them when they are sick, which is already too late. So this is the application that we are using. Hopefully this will increase the number of usage close to 200 million, hopefully in the next 3 to 4 years. And again, our objective to do the screening early, to detect the diseases early can happen, so the intervention will be cheaper and also the quality of life of our people will be better.
Excellent. Thank you so much, sir. And this one goes to DG, Africa CDC, Dr. Kasea. Based on your observation, what role does innovation play in disease prevention, particularly in the context of emerging infectious disease?
Yes, we have to say that clinical trial and research and development are critical for us in Africa. We have our brother from Ghana leading a pharma company, and he will tell you, for us to move forward with our agenda, we need to have research and development. And this is why Africa CDC is putting in place a continental repository platform that will be a one-stop shop for everyone. And this is where we can find all information we need. And we are also working to expand our collaboration with Indonesia. You know, I was discussing with the minister this morning. I said, we have the Pasteur Institute in Dakar. They got WHO pre-qualification for yellow fever vaccine 50 years ago. It means we can also share our experience, and while we are learning, and as the minister said, on diagnostics, we got this donation of 30 PCR machine and 12,000 reagent. Even we can increase that based on our needs. But the most important one is just not to get donation, but to get also the knowledge, what Indonesia did, how we can, you know, scale up that in Africa. I think this is where we are, and it's mostly leading that agenda of innovation by partnering with our key partners like Indonesia.
Okay, now. Arise in the implementing this technology?
Thank you very much. In Africa, the vaccine production is of own challenge because we are not yet that much equipped. But as a company, we are trying to have a risk framework in which we are trying to see that we can have all the accessibility to study that what are the challenges we may have, especially in the area of the tech transfer where we have a technical expertise, when we see the regulations, maturity level from the WHO, so engineering aspect. So as a company, we are keeping our team to make sure that we are able to meet all the challenges. Apart from that, when we do the local production, we have to also align with the government bodies to see that how best we can get a commitment from the government. Because when we produce vaccines, and mostly vaccines are not patronized by the government, can be also a challenge. So we are working closely with the Africa CDC for the pool procurement. If one country is able to produce one of the vaccines, and how this pool procurement at the regional level can take place, and that is one of the challenge what we see. But other aspect what we see in the technical expertise, sorry, where we are working very closely hand in hand with the BioPharm, the team, to get training for our people to ensure that we are able to meet to the same standard what PT BioPharm is having for the same product. So there are so many other challenges, but looks like as a good partnership, we'll be able to ensure that we'll be able to handle all those things.
To follow up on that, any potential collaboration in the pipeline in response to current outbreak in the future? Preparedness for outbreak preparedness? Go ahead.
Yes, as a country, our president has taken a lot of initiative after the COVID-19, and it has been set up the National Vaccine Institute. So under the framework and the ecosystem, there are two companies who are trying to comply that. And in our future plant expansion, we are making arrangement for the pandemic line. Like if there is any challenge, so we have one line idle for the pandemic preparation, where we can take the technology transfer and drug substance from any of the companies from outside, and we can produce not for our country, also for the West Africa sub-region, and even beyond. We are very appreciable about the Africa CDC's role currently, that they are trying to align all the companies who are taking initiative in the vaccine manufacturing, and to guide them that what are the requirements. We are also very thankful for the WHO. They are also taking a lot of initiative for the African vaccine manufacturer to guide them to see that how they can be compliant with time to come.
Okay.
Thank you.
Thank you so much. We only have 12 minutes left, so I would like to address the elephant in the room. This question goes to DG and then follow up by all ministers. Dr. Kaseya, based on your professional judgment, what seems to be the magnitude of the current Mpox outbreak if we compare it to the COVID-19 pandemic and the Mpox in 2022? Go ahead.
I think if the world is neglecting Mpox, they are making a huge mistake. It's the same mistake that we made for COVID. When COVID started, we were thinking it was asymptomatic, it was just for young people, and the world didn't really pay attention. And what's happening with Mpox is so dangerous, not only for Africa, but for the world. Look, unfair treatment. In 2022, when WHO declared the public health emergency of international concern for Mpox, it was because we had, sorry to talk about it, because I want all of us to know what is going on. At that moment, we have so many cases in Europe, but the figure was a little bit fine in Africa. We started to see increase of cases in 2023. That moment, we had the vaccine. The vaccine we are talking about was available. We had medicine, the tecovirimat, but no one gave to Africa vaccine, medicine. They kept that for themselves. And when they decided to lift this status of fake public health emergency for international concern in June 2023, they didn't see that in DRC we had a new clade that came. That is the clade 1B that became sexual transmitted. If at that moment the world wanted to play solidarity for Africa, if at that moment we got vaccine and medicine, we will not be in the same situation today. What's happening today is so bad. Every day we see increase in terms of numbers, increase in terms of deaths, and we are talking about the virus. We don't know what kind of mutation we can have tomorrow. This is why it's important for us to play solidarity. And we saw, I was talking with Minister Budi, tecovirimat that people, they were thinking can treat Mpox, but it's not, efficacy on clade 1B is 0. We cannot use that. It means we need to go to continue more studies to see how we can find a medicine that can cure us. Cutting the story short, it's really time for us to say, let us come together. We already had lessons from COVID. We had lessons from the fake 2022-2023. It's time for us to say, let us come together. Let us provide more diagnostics, more vaccines, and more research for medicines to stop this outbreak.
Thank you for pointing that out, sir. And quickly to Minister Ibrahim, 3 minutes. How are your public health authorities responding? Go ahead.
Okay, thank you very much. We see the world coming from COVID to Mpox to what is next. I think respond to epidemics and pandemics, it is a global response. As said by Jen CDC, thank you very much for what you are doing in Africa. Usually, such like Mpox, for example, till now it is not reported in the country, in Sudan, but as it is a global emergency and of international concern, every country should be alert. And in Sudan, for example, now this is the third year, we keep the surveillance system aware and alert. In particularly, working jointly with the neighboring countries where some cases are discovered. Before 2 months, for example, there is suspected cases in the border between Chad and Sudan and have been tested and confirmed to be negative. But we should be alert every time. The pandemic is, everyone is expected to have the disease. In pandemic, everyone should have the responsibility. The pandemic is not a responsibility of individual country. It is the responsibility of the global humanity in all. Thank you very much.
Thank you. And I think this will be the final question to Minister Budi. How are our public health authorities responding? And to close this wonderful forum, this session, anything else you would like to add to our delegates, to our colleagues? Go ahead.
I will keep reiterating this. Pandemic is a global issue. It is not a local issue. It is scientifically wrong if we believe we can protect our country by ourselves. And it is also ethically very wrong if we are doing it that way. So that's why unless you can freeze 1.3 billion people that every year travel around the world, unless you can freeze them, not to move, stay at their houses, which is impossible. So that is the reason I believe I would like to quote the African quotes. If you want to move fast, you can go alone. But if you want to move far, you have to go together. This is the time that we have to work together, increase the capacity at a minimum standard. All countries, 192 of WHO member states. So we can protect the world. We can protect humanity. We can protect the children, and we can protect the children of our children. Thank you.
Thank you so much. And ladies and gentlemen, join me in thanking all panelists. Unfortunately, that's all the time we have for today. If we want to go far, go together. Big round of applause for all ministers, excellencies. In the spirit of brotherhood, sisterhood, and cooperation, Indonesia and Africa are preparing to create a new chapter in the history of international relations, a success story that we hope we will be remembered by future generations. My name is Puri Anindita. Thank you, ladies and gentlemen. Enjoy the rest of the forum. I'm handing over the session back to the MC. Thank you so much.
Let's give a round of applause once again. Thank you very much, Madam Moderator and all panelists, for this panel discussion 5. Thank you. Thank you very much.